4500. Toll free it's 1-877-597-4500. Now, the Health Minister, Christian Dubé, who you have to remember is the new Health Minister. The former Health Minister was replaced. It was sort of seen as her getting fired from the job because of the way that the first wave went. So Christian Dubé, he came in and he yesterday held a news conference where he outlined Quebec's plan for the second wave. Here's a little bit of what he said.
In particular, the government of Quebec is mobilizing in the following. Identify a manager responsible for each CHSLD. We need to recruit attendants in each CHSLD. Prohibit the movement of employees. Reduce the time taken for the entire screening process. Support an optimal service offer in surgery. Establish clear and agile governance. Maintain a constant dialogue with the general managers to ensure the implementation of directive, and this is how we will respond to the mandate that the Prime Minister has given us. Together, we went through the first wave, and it is together that we will beat this virus.
The Health Minister, Christian Dubé, outlining some of Quebec's plan there for the second wave. Now, to talk more about this, let's now speak with Daphne Nahmiash, who's the acting president of Handicap-Vie-Dignité, an organization advocating for improved conditions in long-term care homes. She's a retired professor in gerontology and social services at Université Laval, and she joins me on the line. Hi there, and welcome to the program.
Thank you very much, Brian. I always love being on your program.
We're glad to have you here. This is Sean, by the way, and I'm wondering. I don't know if you were. Brian is my colleague, and you would have spoken with him already. So I think he's happy to be mentioned here also. How do you feel about what we're hearing from the province right now about getting ready for the second wave, what you heard from the minister just now, or maybe those other details that he was talking about yesterday?
I feel that they were quite optimistic, and they came across as if they're solving everything and everything's going to be great. Unfortunately, I have to remember that in the present pandemic, the people in the care homes, particularly in the CHSLDs, the long-term care homes, they have been, and some of them still are, isolated for 140 days. No professional helpers, no rehabilitation, so they probably had deteriorated health. Most of them have dementia, so they were very confused and alone. No social services, no recreational activities practically, hardly able to go out ever from their rooms. In this heat, they still have no air conditioning in their rooms. And so we have to bear in mind that when we're talking about the long-term care homes and what has gone on in the pandemic and what will be the similar in the second wave, this is the situation they are in, and they're having no quality of care, basically no quality of life either for their end of life. So this is putting it in perspective. At least if you're in solitary confinement, some people have described it in those homes who are able to describe their situations as feeling like being in a prison or a cage. At least in solitary confinement, you get a walk out of your room every single day. They haven't been having that. They've been in survival mode.
So when you hear the province, the health minister, for example, saying yesterday, we learned our lessons from what happened, what goes through your mind?
The first thing that goes through my mind is I'm very disappointed that there was no public inquiry commission so far, and there still is talk of there probably, looks to me like there probably won't be one, because had there been a proper Quebec Public Inquiry Commission making recommendations from the situation, would have been, I think we'd be better prepared for the new wave. long-term care homes. And they mentioned a lot of things that are maybe not realistic, or I don't know how they could do it in such a short time. For example, Margaret Blay mentioned how the private sector had some of the worst experiences, and how she felt that there should be no differences between care in the private sector and the public sector. I'd like to know how they're going to implement that, because I don't actually see them doing that by these things that they are about to do. What we have learned are a few good things. I think there'll be better infection control. I think there'll be less moving around of staff, hopefully, but I think there'll always be some moving around. So I don't think that can become... I have been myself in charge of multidisciplinary teams, and there are always some staff who are absent, who are sick, or who are afraid maybe to actually stay around in an epidemic like that. So
it's a bit disconcerting to hear you say that no matter what the intentions are, there will always be some of that moving around of staff. But I guess you do speak from experience.
And remember, the thousands of people who are coming in who have been newly trained, have little experience about taking care of the people, and the orderlies, they don't do a lot of the social care that I think the people are missing, like recreational activities, etc. They don't have time because they're busy looking after the very basic needs of the people, like giving them a bath, getting them up in the morning, dressing them, etc. I don't think that's going to change in any major way. I think that is a problem. We will have more equipment, I think, and people will know how to put on their mask and gown, hopefully. There'll always be some mistakes made. One of the things I was very happy about was that there will be a manager, which was one of our suggestions in our proposals, in every single CHSLD, in every long-term care home. That is a good implementation if it can be done in such a short time, in terms of the positions, etc.
Daphne, Nahmiash, I want to ask you more about that. I also want to remind people the phone number here, and then I want to come back to that point. I'm speaking with Daphne Nahmiash, who's the acting president of Handicap-Vie-Dignité. She's a retired professor in gerontology and social services at Université Laval. We're talking today about getting ready for a second wave of COVID-19. Want to know, how ready do you think we are? Phone number is 514-597-4500 if Montreal is a local call for you. If it is not, we have a toll-free number. It's 1-877-597-4500. The text line is 514-566-9066. Now, Daphne Nahmiash, I have to confess, when I first heard that about managers, I thought, well, managers are not people who are going to be giving care directly to patients, to residents. Is this necessary? And I think, previous governments sort of looked at that level of bureaucracy and thought, well, it wasn't necessary. But I guess you are saying, no, it absolutely is necessary.
I think it's necessary because there'll be somebody in charge, somebody responsible for the actual place, in the place, who can on a daily basis actually see the residents and how they're doing, and see the staff and how they're doing, etc. So I think there'll be a little bit more control than there has been, because the managers sometimes were taking care of several long-term care homes, and absolutely were not able to put their finger on what was actually going on in the place itself, which is why we were having so many problems, and well, partly why. That was one thing. The actual structures are not going to change, but there will be that one manager who's going to be hired, which will make us a difference. I mean, I don't want to say everything's going to be negative. I'm hoping that it will be a lot better, but I think that will be an improvement, because they will be responsible to the government in terms of the quality of care. And
how good is the government on its side at communicating with and coordinating with these homes and these residences?
Well, we have 400 residences, so basically how can they spend their time really communicating a lot with all these people? They talk about communication, but it doesn't happen much in reality. Even the communication of those caregivers who weren't allowed to go in to visit their relatives because of the COVID, there was there were huge problems of communication, even about their loved one. They should be getting constant, almost daily communication about how their person is doing, what's going on, etc. If they're not able to visit or if they are not allowed to visit, etc. They were not getting that. That was not happening. There were terrible communication problems. So I'm sure the government also is not going to be able to communicate the way to really monitor the situation well. It's impossible to do that. So given the present setup, it will be easier, though, if there's one manager in each place, because that's less of a hassle than having one person taking care of several places and running around and trying to get resources when they're missing, etc.
That does seem to make a lot of sense. Let's bring in a caller right now to this part of the discussion. Local number, by the way, it's 514-597-4500. I'm on the line with Daphne Nahmiash, who is the acting president of Handicap-Vie-Dignité. She's a retired professor in gerontology and social sciences at Université Laval. And joining us now is Randy, who's calling from NDG. Hi, Randy.
Hi, how are you doing?
Quite well, thanks. What did you want to talk about?
Well, I just wanted to let you know a story I got this morning from my mom, who lives in a residence, that in the last week or so, the lunch, rather than it being served up in their rooms on a daily basis, said they could go downstairs now and do in the common area eating. And when I walked by there last week, it was really packed inside and everything. And I even noticed that outside, even the saran wrap around the benches got removed. And she told me this morning that she got a call back that there was a case of COVID and everyone's back in lockdown.
Oh, I am so sorry to hear that. So there was this sort of fleeting moment of things getting back to the pre-COVID normal, and that, I guess, is not working out, right?
No, it doesn't seem to be. So I think it was just kind of getting a little bit ahead of themselves, and I was just kind of shocked at that. But so
how is she doing?
She's a little nervous right now. She's also going through treatment, so she has to go back and forth to the hospital like once a month. So she's kind of nervous now, but she's not going to be leaving anywhere. She's going to be staying in now and just waiting again.
Randy, I thank you for the phone call. We send our best wishes to her and everybody who's at her residence. Thanks again for the call.
Thank you.
Randy calling from NDG. Toll-free number here is, by the way, it's 1-877-597-4500. And Daphne Nahmiash, here we are talking about preparing for a second wave. I wonder how you react to that story that you just heard from Randy.
Well, I heard it from also is in another place. That's a male friend of ours, and he said exactly the same thing. They have a new case right now, and so not out of the room again after all this time of not being allowed out. At one point, I think maybe 2 or 3 times they were allowed to go out into the garden for a few minutes, kind of every day. Oh, not every day, but some days of the week. I think it was 3 times a week. And now it was, again, taken away again. No visitors, no nothing, locked in the rooms. I think from a mental health perspective, the government has done very little in terms of making sure, not just the government, but also the places themselves have done little in terms of trying to help the people with the mental health effects that this is having on them, this isolation for all this time, etc. And to have it happen all over again, I agree with Randy, is kind of a shock for the people. Of course they're nervous. And people, imagine, who have dementia. They become totally confused again. So it's a very serious problem.
It is horrifying to think of the second wave coming while, we are still very, very much dealing with the effects of COVID-19. And I do want to thank you so much for reminding us of some of these issues. And I want to thank you profoundly for speaking with me today.
Anytime, Sean. I love to be on your program. Thank
Good
you.
to speak with you. That's Daphne Nahmiash, Acting President of Handicap-Vie-Dignité and a retired professor in gerontology and social services at Université Laval. Phone number here, 514-597-4500. Toll free is 1-877-597-4500. In a second, we'll speak with Jeff Begley, who